My name is Hiam Nadel, and I am the director for the Center for Innovations in Care Delivery at Massachusetts General Hospital in Boston, and the current president and founder of Sanciel. So today we're going to talk about how to craft your perfect pitch. And this is sort of a high overview of the things that you should be including. So we look at the story. How did this happen for you? What made you realize that this was a problem, and bringing that story to life? And we'll go into much more details about a lot of these. And then from there, how did you identify the problem? What is the problem? How big is the problem? And then what is your solution? And then looking at the competitive space, what's the current solution now? What's out there in the market that's trying to do the same thing? And how does your solution differ and fill the gaps than what's out there now? Who are your customers? Is this the patients? Is this the hospital system? But thinking things through that. The budget, we don't need you to do a complete high level budget, but you need to break down the amount of funding you need and where it's going to go. And then how do you sustain your idea beyond the year that we give you the funding? And then always your team. Who is your team and what are their skill sets? And then you'll close your pitch deck with where you started from, so to bring the entire idea to life again at the end. So I think this is a very important thing to learn, is how to pitch your idea to anyone. It could be to your leadership. It could be to venture capitalists. It could be to a number of things. And also, you will build your pitch deck today, but you will have to modify depending on who you're pitching to and how much time do you have. But today you'll learn how to do the core pitch deck. So what makes the perfect pitch? So we always want you to start with the story. Sometimes, talking about a patient that you identified the problem with, or whatever the story that brings your idea to life. Storytelling is, since the beginning of our existence as humans, that's how we used to communicate, or we still communicate. Also, that's what we remember. Storytelling helps us remember what the idea is and what you're trying to say. And so the story should have three components, which is, what is the setup? How did this start? Why did it start? How did this happen? The struggle, which is the problem, really, which includes a number of things, and I'll show you in a minute. And then your solution and how it solves that problem. Tell us if there is a personal connection. Sometimes you can really understand a problem just from seeing it, or were you involved in this, or have you really connected with this problem? And then storytelling really helps pull the heartstrings of the judges and panelists in a meaningful way, so that they remember, and you want them to really partner with you and collaborate with you, give you the funding so that they see this story through. So this is just a graphical thing about the storytelling. So again, the setup, the struggle, and then bringing it back to the solution at the very end, so that you really wow the panelists and the judges. So I always like to get the pitch across. I think people remember it by what we call the 4H framework, which is the headline, the heart, the head, and the hope. And I'll go into more detail for each of these, but I also want to tell you, once I'm done with that, we will show you a pitch deck that is mandatory to use, and then we will go through that, and then I will open it up to questions at the end. So let's consider the first H, which is the headline, and this is you're setting the context by your storytelling. So you want to have a team name, and this is an example of one of the teams that did the hackathon in 2019 with us, and they're called Lumify. So it sort of gives you a little bit of an insight into what what their idea is going to be, and then a little bit of a tagline that this is the community marketplace for healthcare workers. So this sets the stage and sets the context. The next one is your heart. And this is where you tell us the story, how you came about to identify the problem, and how big is the problem. So for example, if I had a patient who I developed a close relationship with, who had a stroke, but fell just before discharge and had a brain injury and had to go to the neuro ICU. And now that changed for us, and his family was upset with me. So, looking into this, patient falls in a hospital are a big problem. And the big problem is about $52 billion a year. So that's just an example of how you want to tell your story. How big is this problem? And our current solution right now, we just tell patients to please call us when you need to get up and get out of bed, but they don't. And then who's affected? It's not just the patient that was affected and had a bad injury. I was affected. And other nurses that have patient falls get affected. The family was also affected. Really bring this to life through your story. The head is your solution. So how are you going to implement this? And what have you identified as gaps already in the competitive space that you're filling? So a lot of the funding will go to how are you going to implement and what are you going to be learning from this? And we want you to have thought through a minimally viable product, not the end solution, but really something that you can actually get it out there and test it. And as you see on this graph, it's the minimally viable product is number 3, right? So we thought about a solution, we advanced it a little bit more, but now I have number 3 to really put it out there, have people test it, because where we end up is usually the car, but we had to start somewhere. And then how does it work? What is currently being done, and who are your competitors? What other companies are trying to do what you're trying to do? And you really want to hone in on their inefficiencies and their gaps, and then show us in a graph, which I will show you shortly, on how you display that to show how your solution fills that. An investment means what are you going to do with this investment that we give you, this funding, and how are you going to scale it? So, for example, are you going to start on a specific patient problem, maybe patients that I just said in the stroke patients, or are you going to start on a specific unit, a specific hospital? So let us know where you're starting and how you hope to scale that. So first I start on a unit. Now I want to get all the units, the entire hospital, now all the hospital systems within my umbrella. And so that's what we mean about scalability. In terms of hope, you want the panelists and the judges or anyone that's listening to you. What is your vision? And at the end, you want 3 things to remember and ask of the audience and the panelists and the judges. And then you want to have a slide with all your team members' pictures and their skill set, because you want to show them the wonderful team and how they're going to contribute to your solution within your big close. Okay, so that's the 4H framework. But some presentation tips that I'd like to talk about is all of you, your entire team should be dividing and conquering. Okay, so one of you looks at the competitive space, one of you is building your template, someone else may be looking at, drawing up the solution or the minimally viable product. So the more you divide and conquer, the better. We really encourage you to have less words on each slide and more pictures that can speak to. So you want to speak to your slide and not have people, when you have too many words, people are actually trying to read rather than listening to you. And then honestly, you should only have 1 or 2 presenters, because you will have, if you make it to the finalist, you will have 7 minutes to pitch, and going from presenter to presenter actually takes time. And then, of course, practice, practice. And as you practice your pitch, you will realize what you should include or shouldn't include in your pitch. All right, so we're giving you a mandatory, you know, pitch deck, and here you will see in a minute what that includes. But again, we encourage you to only have about 14 slides maximum, including your title slide. And on each slide, you'll see in a minute, we give you a suggested amount of time to spend on each slide and what each slide should include. So we also ask, which is really important, is not to have videos because again, what we've noticed is that videos don't work or it takes time up, so you cannot embed any videos into your presentation. All right, so here's the template that is mandatory to use. And the first one is where you'll put your project title and logo. Again, please erase a lot of these because, you don't want project title and logo to appear and then you're writing below. So erase a lot of it, but you keep the template as is in terms of what we're providing with you. So the story, again, you'll see that what your story should consist of. You have a personal connection. We give you suggested time, if you see to the right, that you should only be spending about 45 seconds. And then a tip, make sure the story is thread throughout your presentation. And again, once you start populating this slide, please, again, erase a lot of this so that it doesn't show when you're doing your presentation. Again, the opportunity and the problems statement to reiterate what is the problem, how big is the problem, what is currently being done, and why isn't it working, so that when you come to the next slide where you'll show your solution, people can understand why you needed to come up with a different solution. And this, we ask you to spend about a minute. And then moving on to your proposed solution. This is where you should be spending most of your time. Describe your solution very clearly, very concisely. And I always say, do a step-by-step process. If you're describing something in the OR, not all of us have worked in the OR. So, really make sure, and then some of the judges and panels may not even be clinical. So you want to describe that step-by-step so we really understand it. Again, giving evidence and data. Highlight your key activities. What are the primary outcomes and impact? Do you have goals, specific, measurable, achievable, relevant, and timely? And impact and describe the overall impact that you hope to achieve and how you will measure it. The competitive slide, again, this is just a example of the graph you could use. You're welcome to use that. And when you look at the benefits column, you should put the benefits that your solution is impacting. So in other words, you don't have to use the intuitive design, the cost performance. You should be writing exactly what your solution, what are the benefits, and list it. And then when you're looking at the market and all the competitors, how they meet or don't meet any of those things. So really just visually just differentiates your solution amongst what is out in the market. And we'll all be here to help you, by the way. So customers who will want to use your solution, and how big is the market you're creating the solution for, number of patients, number of providers, number of health systems. And then the budget. So provide the total amount of funding you are requesting, up to $150,000. Please, if you don't need the $150,000, do not ask for it, because that might allow, if you only need $50,000, then state that, because that might allow us to give more money to more teams. Please note that this is a one-year grant and the money must be spent in year one, from January 2025 to December 31 of 2025. Provide a detailed line item budget for year one, and I'll give you an example. To help plan your budget, I usually write everything that I'm going to need: time, skills, engineering, IT people, prototype development, etc. Write it all down, what you think you need, and then you can back into how much money it will cost. And then provide a high-level overview for budget year 2 and 3. And how are you going to sustain it? This is where your executive leadership will come in. Describe how this is going to be sustained over time. Now, some of you may need more than $150,000, and it is okay to ask for that, but you need to tell us who will be funding the amount greater than $150,000. Here's an example of a budget. Again, this is an example. You're welcome to use it, but if you use a different type of budget, then please go ahead and use that. In sustainability, again, just to describe that, what is your executive leadership, your hospital, your health system? How are they going to help you develop it? Or at least, are they going to give you time? Will they be putting in funds to sustain it? Again, we really want this. We really want to understand how your executive and senior leadership are committed to your solution. The team, again, I always say just put their picture up and their skill set, because if you run out of time during your pitch, then the panelists and judges will be able to visualize who your team members are and what they bring to the table. And then, of course, the big closing, thread your story back in and, close with the 3 things you want the panelists and the judges to remember. Okay, now that we're done with that, I just wanted to be able to give you the evaluation criteria, and you will see the potential systemic impact on creating a thriving workforce and healthier work environment. As you can see, how innovative is your idea, how you will implement it, and the feasibility of the solution, how you spoke to the sustainability. Your interdisciplinary team, we highly encourage that. So if you can, bring others to the table, business people, senior leadership, engineers, whatever you need. And then how you're going to measure it. So we will look at that. And this way you will have all of this to reference back to. And then again, your funding, you cannot be used for baseline research or exploration. We want to know how you're going to implement this the first year. You can't pay for brick and mortar costs, lobbying, grassroots lobbying, provisions of healthcare services, for example, direct patient engagement via telehealth service. Pass-throughs to healthcare providers you cannot be using, and/or government officials or employees. Payment towards past development activities, for example, a payment of a business loan, as so those you may not be using the funding for. But what you can be using it for is, people ask, can we use for staffing and salaries? And yes, you can, but it cannot be greater than 30%, including overhead. And can my project exceed? Again, I spoke to this. Yes, it can exceed, but you need to be very clear on how and who is going to support the remainder of the $150,000. So recommendations when you're building your pitch is ensure that the project budget is realistic and appropriate given the time frame of 1 year. Only include items within the budget that are essential to the implementation of the program. And then please meet with your executive leadership very early on to secure support and commitment for implementation and sustainability. Thank you. And now we'll open it up for questions.